Most of the times patients might have a lot of anxiety or be kind of afraid of surgery, and that's completely normal. And usually what they're afraid of is how they're going to feel afterwards. Is it going to be very painful? And sometimes I'll see these patients and I'll talk to them multiple times prior to surgery. I'll reassure them of what our goals are during surgery, what are my techniques. Sometimes I use specific medications after surgery to make them feel better, and I always use a medication during surgery while I'm performing liposuction that helps treat pain. And usually patients after surgery will tell me that it's not as bad as they expected. They're actually very comfortable. First couple days they'll be sore, and that's completely expected. But with the right pain medication regimen, very tolerable, and they do very well. Liposuction removes fat cells from targeted areas, and once the fat cells are removed, they cannot grow back. Now, with that said, as a patient either loses weight or gains weight, the remaining fat cells in the body can definitely get larger or smaller. So as far as removal of fatty tissue, liposuction is permanent. That fatty tissue will not grow back. But I always instruct patients, prior to surgery, you want to kind of have a very healthy lifestyle with nutrition and exercise, and it's very important to maintain that after surgery because that'll give you optimal results in the long run. An example of a patient who I performed liposuction on who was very happy afterwards was somebody I saw before surgery. She's a mother, she's had multiple children, and she just had a couple areas on her back and on her abdomen as well as around her waist that were just troublesome and bothering her. And when she would put on a dress, she felt like she just wasn't looking as good as she would like to. So what we did is we came up with a plan together of certain areas that we could treat with liposuction. And in the first week after surgery, I told her swelling and bruising is completely normal. But after the first 2-3 weeks, she started to continue with her postoperative massages. She started to really see the shape that was created, and she started to see curves again, and she was slim. And as far as putting on a dress, she was a couple weeks later very happy and seeing the curves that she had prior to multiple pregnancies. Liposuction is a cosmetic surgery, and the goal of liposuction is to create the ideal aesthetic for each individual patient undergoing a body contouring surgery. Liposuction is not emergent surgery, it's not required, you don't have to get liposuction. And that's why I like to see patients during the consultation. I like to ask them, what are their goals? It's really important that the surgeon and the patient are on the same page to see what is an expected realistic outcome. But liposuction in the right patient can be a great surgery because it treats stubborn areas, but the patient has to be mentally prepared to undergo the procedure. It's not a small procedure, it is a legitimate surgery. A day after liposuction surgery, I usually tell patients what they can expect is they'll be in a compression garment because they'll wake up with one on after surgery. I'll have had sent them pain medication because they'll probably be a little bit sore the day after surgery. They'll have some swelling that's completely normal and expected after liposuction surgery. But really the day after surgery, what I tell patients is hydrate, walk as much as you can, really no strenuous activity because that's gonna kind of increase their pain and make them uncomfortable. And really I like patients to have a support system at home, whether that's family or friends, that can help them around the house, whether it's making something to eat or ordering food or whatever it is. But usually it's the first couple days after surgery that patients are a little sore and can be a little bit uncomfortable. Some examples of strenuous activity that I want patients to avoid is really lifting anything above 10 or 15 pounds. But if they're home, using the bathroom should not be an issue. Even if making themselves something to eat should not be an issue. And every patient's different. Some patients will be a little more sore than others and need a little more help around the house, and that's completely fine. And other patients the day after surgery will say that they were able to kind of cook and do little small chores around the house and their pain was well controlled with medications and they felt great. It's really up to each individual patient. Everybody heals differently. There's a different amount of liposuction performed on every patient. Not every patient is one and the same. But what I tell them in general, you can expect to be a little sore for the first couple days, but nothing out of the ordinary. Wear your compression garment, hydrate, eat food, and really walk around the house. That's really important after any surgery. After liposuction surgery, I'll tell patients immediately after surgery, walking around is really important. And what I kind of tell them is every hour, try to do kind of a lap around your house. And then afterwards, you can sit down. And that's really important for any type of surgery that I perform. I want patients up, moving, and walking immediately after surgery. After liposuction surgery, your body heals from the inside. It is traumatic. We're performing any type of surgery. We're traumatizing some of the tissue, obviously strategically. And your body kind of just repairs areas that are traumatized. And the skin will typically re-drape over the area where we perform liposuction. where we remove the fat under the skin. And we specifically target specific layers of fat under the skin to contour the body as nicely and aesthetically pleasing as possible.